The next is about the mukharoga, the last chapter of the Nidanasthana. तथा मुखरोगाणां निदानं व्याख्यास्यामः यथोवाचं भवन्ति मुखरोगाः पञ्चषष्टिः भवन्ति. There are 56 65 mukharogas are there. Saptasu ayataneshu at 7 regions. The whole area of the mukha ENT, now we say ENT 3, but whereas from Sushru's point there are 7. ओष्ठौ दन्तमूलानि दन्ताः जिह्वा तालु कण्ठः सर्वाणि चेति दन्त दन्तमूल ओष्ठ जिह्वा are this. Now the current situation, dental and dentistry, are not beyond the purview of general medicine. The dentistry is a separate discipline now, whereas Sushruta had considered this as a inclusive issue. तत्र अष्टौ ओष्ठयोः पञ्चदश दन्तमूलेषु अष्टौ दन्तेषु पञ्चजिह्वायां नमतालुनि सप्तदशकण्ठे त्रयः सर्वेषु आयतनेषु. These are the distribution of the diseases. Now the first of this would be the Ostha. तत्र ओष्ठप्रकोपः वातपित्तश्लेष्मसन्निपातरक्तमांसमेदो अभिघातनिमित्ताः. The lesions of the Ostha, their slip would be of 5 varieties and they are Vata Pitta Kapha 8 varieties. Vata, Pitta, Kapha, Sannipata, Rakta, Mamsa, Medas and Abhigataja Oshtaprakopa. Among them, the first is the Vataja. Karkashau, Parushau, Stambho, Krishno, Tivar, Ruganmito, Dandete, Paripatate, Vosto, Maratokopadaha. In case of Vataja variety of the Oshtaprakopa, there will be a exfoliation, there will be scaling, and the lips they tend to be looking like rough and maybe somewhat hard, firm, and color also tends to get changed, and there could be abnormality of the sensation. Dalyate paripatya, there will be cracks over the area and scales over the area. Now this is typically seen in case of exfoliative cheilitis. Exfoliative cheilitis is often produced due to a chemical irritation. Very often the common cause would be chemical irritation, most of the times due to the lipsticks. Or occasionally it could also be a sign of systemic disorders of skin. Is as good as any other skin disorder. Dermatitis like conditions also may be extending into the lips as such. So in general, the keratinized layer is more prone for the inflammatory exfoliative lesion. A non-keratinized lesion like area like the lip mucosa also can get affected in case of some of the exfoliative pathologies. Whereas most commonly we see this in case of the chemical irritation. So most of the patients who have that exfoliative cheilitis would have a history of contact with the chemicals, and the treatment also is relatively simple. You have to avoid that. Then the Achitau Vidaka Bistu, Sashapa Akriti Bhiprusham, Sadaha Pakasamsravo, Nilo, Pitau de Pittadaha. Pittaja variety of the Oshtaprakopa is presented with the multiple eruptions which are initially small, and it also presents with the sepsis, clinical signs of sepsis, Paka Samsrava. There could be discharges or even pus formation in these, and the colors could be either yellowish or bluish colored swellings. Now this is typically in case of the granulomatous cheilitis. Granulomatous cheilitis is commonly seen in patients with leprosy. Patients of leprosy often can present with this kind of a symptom, or it also could be presented in any chronic inflammatory pathology. Patients of chronic inflammatory pathology like rheumatoid lesions also may present with these symptoms occasionally, rarely, where there will be multiple eruptions over the area and there could be even sepsis. Rarely a septic pathology like streptococcal infections also can occur in the area, but in that condition there will be a huge local abscess, but multiple eruptions these are typical of the granulomatous cheilitis, quite commonly in leprosy, and it could also occur in other conditions. Then Savarnabhisutiyete Pidakabhi Avedano Kandumanto Kapat Shuno Pichilo Shitalu. In case of the Kapaja variety, there will be no discoloration and a soft swelling over the area which doesn't have pain, and that's the typical lesion. This is exactly the clinical feature of what we call as a mucocele. Mucocele and epilis, these are the two commonly seen cystic conditions in the lip as such, And mucocele is often a consequence of a previous injury. Some minor injury over the area may result in a mild damage to the epithelial tissue, which could be covered by the mucosal area. Gradually, that degenerated substance may result in a cystic swelling, and it's quite common. These conditions are quite common. It's painless often. There will be a localized swelling. Ultimately, it needs to be excised. The content will be mucin-like. Epulis also is a relatively similar condition, but in that condition you will have a thicker layer of cystic wall over the area. Epulis is often seen in the gums also, as well as in the lip area, whereas mucocele is more commonly seen in the lip, and the usual cause is a previous injury as such. That's about one of the conditions. Then सकृत् कृष्णौ सकृत् पीतौ सकृत् श्वेतौ तथैव च सन्निपातेन विज्ञेयौ अनेकपीडकाचितौ when multiple colored lesions over the lips with damage to the surface and could suggestive of the pus formation is typical of the Chiloseri variety. This is what we see in case of the glandular cheilitis with infections. Glandular cheilitis is often produced due to infection of the glands, mucin glands of the area, tongue area, and the exact reasons are not known. Often it's seen in patients who have used antibiotics for a long duration for a treatment of some other condition. Quite commonly, very frequently seen after typhoid. Patients of typhoid, after having treated the typhoid, for the typhoid, they tend to develop these features. Or it can occur in any of the other conditions too, where the patients are given antibiotic for quite a long period, and later on there could be some resistant strains developing over the area, and the patient may have glandular cheilitis. Glandular cheilitis also could be seen in patients with the reduced immunity, like HIV or tuberculosis and so on. Of course, candidiasis is more common there, where whole of the mouth could be involved, or it also can be presented as a glandular cheilitis, where the lips would be swollen and pain would be there. Then Kharjura Falavarnabhi Pidakabhi Samachitau Raktopasastau Rujiram Savadashunita Prabho. In case of the Raktaja variety, the swelling would be looking like Kharjura, that's a dark reddish color or grayish color, and there could be eruptions over the area, one single or multiple eruptions, and they look like blood, and whenever they are opened, that produces the blood. That's exactly seen in case of the hemangioma. Hemangioma of the lips is again quite common. Hemangioma can occur anywhere in the body. In the lips, because the tissue is relatively soft and smooth, lips, hemangioma in the lips is quite common, and it is presented as a painless swelling which is having a bluish color, and whenever it gets injured there will be bleeding from the area, and that's typical of that. Of course, hemangioma can occur elsewhere in the body too. It's not that it occurs only in the lips. Then मांसदुष्टौ गुरुः स्थूलौ मांसपिण्डवदुद्गतौ जन्तवश्चात्रम् उच्यन्ते सृक्कस्य उभयतो मुखात्. In case of the Mamsadushti, Mamsajavasta Prakopa, there will be huge swelling, big swelling, which looks like polyp-like, Mamsapindavata, where there will be a polyp-like projections, fimbriated projections over the area, and there is a possibility of even maggot formations. That's necrosis, evidence of the necrosis seen. This is typically seen in case of the cancer of the lip. Cancer of the lip is now increasing quite frequently, and it's often related to the habit of consuming tobacco, particularly the tobacco kept in the oral cavity, like jarda. That's supposed to be the one common cause. As it, smoking also is a well-known cause for the lip cancers, and incidence of the lip cancer is increasing very rapidly in the later half of life, which initially starts as a small ulcerative lesion, then it becomes a proliferative lesion with a lot of induration. There would be even damage to the tissue. Tissue could be damaged later on. Then Metusa Ghatamandabho, Kandu Stira Umrudu, Acham Spatika Sankasham, Asrabam Sravto Guru. This is typical seen in case of the lymphangioma of the lips. Lymphangioma also is a congenital pathology, as in case of the hemangioma. There would be increase in the number of lymphatic vessels, and they will be proliferated, and it's presented as a somewhat transparent or maybe whitish colored swelling, and usually painless. and this it's also called as macrokelia. The other term is macrokelia means big swelling, big lips as such. It is also a congenital condition, though not very common, rare, and it can be presented, seen in children, quite often in children, and they need to be treated with surgical. Otherwise, it can result in a huge swelling. It can go on increasing in the size, and it can become quite huge. A painless, soft swelling in the neck, and often it looks like the swelling is compressible. When you put the pressure, it looks like the swelling can be compressed, but again, it can be enhanced again, and that's the typical of the lymphangioma. Exactly the same picture as described by Susla, where it will be stira and mrudu, a soft swelling, and which contains a substance which looks like grisomanda, somewhat clear but gelatinous substance, or achas, clear substance, or spatica sankasham. There could be some crystals also. That all depends upon the stage in which you see. In case of the lymphangioma, the substance should be fatty, liquid substance, which is seen, and that description is quite obvious. Then the Kshatraja, traumatic induced condition. Kshatraja Budhiriyate Patyate Abhigatataha Grasitau Samakhyatau Ostau Kandu Samanvitau. Kshatraja is where there is an injury, mechanical injury to the ribs, and it can be mechanical injury can occur due to any reason, and then naturally that would not heal easily. So of course, the lesions of the mucosa, they have a tendency to heal rapidly because the proliferation of the mucosal layer is quite high. But if there is a huge gap at the area of the injury, it may not heal and it may result in the septic focus. There could be a lot of necrosis of the tissue, and that kind of the conditions are the Kshatraja variety, where there is a trauma. And there it will be Vidiyate, Patyate, Abhigata. There will be Abhigata as such. Of course, one of the condition which we often see is angioneuritic edema. Angioneuritic edema is an allergic reaction where there would be a sudden development of a huge swelling of the lip, and it's usually soft, and it may get subsided later on once the allergic phenomena is reduced, and it can occur repeatedly. Patients who have a tendency for the allergy, they may develop that angioneuritic edema quite frequently. Repeatedly it can occur. Temporarily it may be there and it may again reduce. Even that may be considered as a Kshatraja variety. That's about the Oshtaja Vyadhi. Then the Dantamulagatastu. शीतादो दन्तपुटकः दन्तवेष्टकः शौशिरः महाशौशिरः परिधरः उपकुशः दन्तविदर्भः वर्धनः अधिमांसः नाड्यपञ्च इति. These are the Dantamulagata Vyadhi. Now Dantamula, by word meaning, it suggests about the gums or the substances which cover the tooth. But now, and Danta is the tooth as such. From the definition, current definition of tooth and the tooth suspensory structures, we have the tooth separately, and in the tooth you have enamel, dentine, and the root as such, and beyond that you will have the gums as separately. So in general, the Dandamula can be translated as gums, but actually the real meaning, if you go into the text, like you will see that Dandamula is referring to the portion of the tooth which is not really visible. The visible portion, the upper portion of the tooth, where you have the enamel and the dentine area which is visible, that's considered as Danta Vesushuddha. So Dantamula, though it's often translated as the gums, it may not be totally applicable, because when you go into the lesions, you will see some of those lesions which otherwise are considered to be diseases of the teeth. Now, but Sushila has considered them as Dantamula. So we need to interpret that in a different manner. Dantamula, we will consider those areas of the covered areas of the tooth, whereas Danta is the visible area of the tooth. Now, among them, the first is Shonidam Dandabestebhya Yasya Tasmat Pravartade Durgandhini Sakrishnaani Prakleni Mrudunija Danda Mamsani Shiryante Pachantija Parasparam Shitado Namasavyadihi Kapha Shonit Sambhavaha. Shitada is one of the conditions where there would be a hemorrhagic tendency for bleeding, which can occur repeatedly, and there could be a foul smelling discharges, and there could be destruction of the structures, soft structures of the gums, that's the mamsa. the soft part of the gums could be involved. And this is typically seen in case of a inflammatory pathology of gums, which we call as gingivitis. Gingivitis means simply inflammation of the gums. Inflammation of the gums could be produced due to various causes and various organisms. A hemorrhagic is often produced due to hemorrhagic organisms like hemophilus-like conditions, and it presents with the exactly similar clinical picture where there could be localized lesions and there could be hemorrhagic spots. Later on, it can result in ulcers in the gums also, and of course, they can respond very well to antibiotic treatment. So that's the gingivitis of hemorrhagic nature. Now, Danteho Trishua is Shaitu Sarujo Mahana, Danta Puputako Kaparatanimitija. A Danta Puputaka is a situation where one or two teeth nearby, two or three, of course, substances, two or three teeth nearby, they are involved where there will be a painful swelling and typically a soft swelling with evidence of opening punctum-like condition. This is typically seen in case of the gum abscess, which is a septic pathology. Of course, this also is a consequence of the gingivitis. Now, in the present day situation, we consider this as one of the presentation of the gingivitis only, where there could be an abscess formation. The inflammation is localized, and the one variety of gingivitis is hemorrhagic. The other is where there could be an abscess formation. Of course, there are other more varieties also. Then Sravanti Puyarjunam Charaha Dantaha Bhavantija, Dantavesta Sabigneha Dusashonisamhoha. In the Dantavesta, it's again a swelling present in the area, and it can present with the Puya Rudira, that's pyogenic pus-like conditions, discharges may be seen, and it affects the integrity of the tooth. The tooth may be affected, Charahadantaha, the tooth may be later damaged, destroyed as such. That's called as Dantavesta. This also is a consequence of the gingivitis, where there could be a boil instead of a typical abscess, where you will have all the clinical signs of inflammation. It's something like the antibioma. The pus may be accumulated without local signs of inflammation. It may penetrate deep into the tooth root, and it can result in what we later on what we call as the tooth root abscess. So initially the lesion would be limited to the gums, the soft tissues of the gums. Later on it may spread to the tooth and then produce a tooth root abscess. Such are the conditions of gum boils, and there not much of a difference clinically. A gum abscess and gum boil, there's not much of a difference except for the fact that in a typical gum boil there would be an opening to the pus. Now in the gum abscess, you'll see the pus very superficially and it may open up. So chances of getting up to the root would be lesser. Whereas in a gum boil, because the layer is thick, the pus may be penetrating deeper in, and there is a risk of involving the tooth root as such. Otherwise, they are the similar issues. Then, Shayatuhu Dantamuleshu Rujavan Kaparaktajaha Lalasravi Sabidneha Kanduman Shaushirogodaha. Shaushira is a situation where there would be a painful swelling at the dantamula, at the root of the area, and that's also called as root abscess, tooth root abscess or periapical root abscess, where at the tip of the root there would be an abscess. And from the current point of view, it's always a complication of some interruption in the enamel, very often caries, often a complication of caries. Infection spreads from the enamel into the root and then reaches to the base of the root and forms an abscess. It's acutely painful. This condition would be acutely painful because you have the nerves, huge number of nerves at that area, and at the surface you may not see much of the signs. You may be able to localize the abscess only with the investigations, radiological imaging only, that could be the signs, and it's also quite common cause for the toothache. They commonly seen to acute pain in the tooth area. That's the root abscess, and that's exactly the typical description mentioned by Sushruta. Shayatuhu Dantamuleshu, there would be swelling at the Dantamula, and Rujavan, there would be acute pain. Lalasravi, it can result in excess of salivation. Then Dantaha Chalanti Vestebhya तावचाप्यवतीर्यते दन्तमांसानि पच्यन्ते मुखं च परिपीड्यते यस्मिन् सरोजो व्याधिः महाशौशिरसंज्ञकः. Mahashaushira is a situation where the tooth becomes unstable and the covered areas of the tooth, that's the vesta, danta vesta, the gums, they become these recessed, or they become now atrophied, avadiyate, they become atrophied. Even there could be septic complication, danta mamsani pachyante, it can result in the sepsis of the tooth also. This is exactly what we see as the gum recession. Gum recession is often attributed to the habits of cleaning the tooth with lots of these thick or rough brushes, or many times it also could be related to the chemicals present in the toothpaste, or another cause for the gum recession is bruxing. Bruxing is a habit of crunching the teeth, particularly in sleep. Some people would have that habit of crunching the teeth, particularly in sleep, and this can also result in the atrophy. And then, of course, there is a genetic tendency too, where the gums become atrophied. Major area of almost the whole of the tooth enamel, even up to the level of the root, could be exposed, and it can result in the complications. Like so, the gum recession is one of the condition. Of course, it's a very difficult condition to be treated now. Sushruta also has considered this as a Mahasausha, and it's Tridoshuja. Sarvajaha is Tridoshuja as such. Then Danta Mamsani Shiriyante Yasmin Jivatitapya Sarga Pitta Asr Kapalyo Vyadhi Nyaya Paridarohi Saha. That's a infective pathology where there could be hemorrhagic tendency, and Danta Mamsa, the soft structures of the gum, they tend to become atrophied, and it can result in bleeding. Now this also is a inflammatory pathology, a variation of the gingivitis. So from the present day situation, it's a variation of the gingivitis when the infection is more localized in the peridental area, just at the close to the enamel and at that angle, the infection is localized, and hence it is also called as a periodontitis. And it's often related to the unhygienic status of the mouth. Those who do not have a habit of cleaning the mouth properly, they tend to develop the periodontitis, where there could be foul smelling breath. It's also a very common cause for the foul smelling breath. You will see these depositions at the base of the root, tooth as such, and it can result in infective and it tends to bleed. The whole gum becomes fragile because it is inflamed. It becomes fragile. So when you brush, there could be bleeding seen as a, that's the periodontitis, which is common, very common seen. Then वेश्येषु दाह पाकश्च तेभ्यो दन्ताः चलन्ति च आघट्टिताः प्रस्रवन्ति शोणितं मन्दवेदनाः आध्मायन्ते सुते रक्ते मुखं पूतिजायते यस्मिन् उपकुशत्सत् स्यात् पित्तरक्तकृतो गलः. Upakusha is another of the condition where there would be a increase in the mass of the soft tissues of the tooth, and the tooth tends to get covered with the soft tissues, and because of that tooth getting covered with the soft tissue, it tends to bleed. Now, and aghatitaha prasravanti, when there is an injury, it can result in the bleeding, and agmayante sute rakte mukham putijayat. As a result of that bleeding, there could be either this whole lesions may become swollen because there could be a bleeding within the mucosal area, and it may something like a hematoma can occur, or it also can result in a foul smelling breath or the complications like. Now, this kind of a situation is seen quite commonly, either drug induced. Among the drug induced conditions, the most important is eptoin, anti-epileptic drug. Eptoin, diphenylhydramine, given for a long duration, often results in the hypertrophy of the gums. It's one of the adverse effects of the hypertrophy of the this drug, like. And due to that hypertrophy, the teeth tend to get covered with the soft tissues, and as usual, it's a common sense prevails. Like when there is a soft tissue covering the tooth, whenever you eat any hard substance, there could be injury and bleeding, and all the same complications can occur. Another similar situation, other than that of the drug-induced conditions, is the scurvy. Scurvy, the vitamin deficiency condition, where there is a tendency for bleeding, and the patient may have even gum hypertrophy. And here, it's exactly as described by Sushil, like adhnayante sute rakte. Due to that bleeding, the blood will be accumulated below the tissue, and you will see sacs of blood which may tend to bleed acid. And scurvy patients also have a tendency to bleed from elsewhere too, but important is from the oral cavity. Most of the patients of scurvy initially present with the bleeding from the gums as the major sign, and this is the Upakosha. So I would consider the Upakosha both these conditions: gum hypertrophy produced due to drug-induced conditions, or scurvy-induced dental pathologies also can be considered as the Upakosha as such. Then घृष्टेषु दन्तमूलेषु संरम्भः जायते महान् भवन्ति च चलादन्ताः सः वैदर्भो अभिघातकः is a hypersensitive gums abnormality where whenever there is a rubbing of the gums it can produce a hypersensitivity. Now from the current clinical point of view, we do not make out that difference between the hypersensitivity of the gum and the teeth. We consider both of them as the same condition. From Sushruta's point of view, is the hypersensitivity. Causes for the hypersensitivity is when the nerves are irritated or when the nerves are exposed. Now, in a normal tooth, the nerves are well protected by a hard layer of enamel, which we also as crown, called as a crown. Then you have the dentin, the relatively softer structures, which allows for the growth of the teeth as such, and then the root, where pulp of these, where you have all the vessels and the nerves together. So, and because in a normal situation these nerves are well protected, they do not get sensitized easily. If there is any disruption of any of these areas, if there is enamel is broken, as in case of the caries, or maybe any other injury, or dentin is damaged due to degenerative changes, or gum is receding, the gum which covers the area has receded and there is a cleft formed, it also can result in a possibility of injury to the nerves. Infective pathologies at the base also can result in the injury to the nerves. So there could be multiple causes which can produce the hypersensitive teeth as such. Hypersensitive teeth would be presented as a increased pain whenever there is a stimulation of the tooth, whether it is due to the touch or whether it is due to the heat. These are the two differences. Now, heat sensitive or cold sensitive teeth is often produced as a result of a damage to the root as such, tooth root, whereas a hypersensitive nerve endings, nerve irritation, total nerve irritation often presents with the sensitivity to the touch or pressure. So whenever there is a pressure or pain, touch, that could present as a pain as such. Then the next is Ajidanta, where or Vardhana. Vardhana is or Ajidanta. Ajidanta also is presented as the abnormality of the Astidhatu, Astivriddhi Lakshanas. Now, anyway, Martena Adhika Dantaha, Jayate Tivravedana, Vardhana, Samataha, Vyadhi, Jate Rupcha Prashamyati. Now, its Adhidanta is an excess of the tooth, hyperdontia, or supernumerary tooth. Uh, it's also a frequent genetic event where instead of the usual 32 teeth, there could be more. And these teeth which are in excess and which do not align with the typical line of the tooth may produce pain as they get erupted. Once they get erupted, the pain will be lesser. This also is related to the wisdom tooth. Of course, periodontia, hyperodontia is a comparatively less common, but rarely you may have such conditions. This is one of the rare photographs where you will have huge number of these tooth, almost the whole of the palate is presenting with the tooth. This also can occur rarely, but one or two teeth is common, but though not very frequent, you can see them. Now, a similar situation where there could be an extra tooth which is presenting and as it gets erupted, it produces a pain or in case of the molar tooth, last molar tooth, which is also called as wisdom tooth. Sushruta refers to this as adhimamsaka. See, that Vardhana and adhimamsa, from the current point of view, it is the same, erupting extra tooth or tooth eruption produce pain. Now, Vardhana could be anywhere, but Adhimamsa is related to Hanavir Paschimedante, the last two molar tooth of the gums, these mandibles or maxilla. They produce a pain, Mahan Shodaha. There could be swelling and pain, Lala Srabi. This is Adhimamsaka. The only difference between the Vardhana and the Adhimamsa is in the Vardhana, the tooth are excess. Adhimamsa is a normal erupting tooth which occurs which erupts at the later half of the life, after the age of 12, which we also call as the wisdom tooth. Now, it has nothing to do with the real wisdom, but somehow the name has come in, and it's a very frequent issue. in the later part when it erupts, because the mandibles and the whole gum alignment, the teeth alignment has become firm now, it can produce the pain, and very often the pain could be so severe that it needs to be removed. And this, and till it gets erupted, there will be pain. Once it gets erupted, the pain will be lesser. And if it gets impacted in between, then the pain will be continuous, which is confirmed by the X-rays, and then it may need this the extra wisdom tooth which is impacted in below the other molar tooth, and which needs to be removed, excised as such. Then Dantamulagata Nadia Panchajnyaha Cheritaha. The Nadi are categorized as 5 by Sushruta, depending upon the extent of the Nadi. Now, Nadi is uh, a tube-like lesion, which is also called as caries. The exact meaning of caries also is same, burrowed hole. Caries means burrowed hole, and it's also very common infective pathology of the tooth. Caries can be presented in any way, like either it could be involving the gum enamel, it may be enamel at the root, top of the enamel, center, or it could be like at the edge of the enamel, or it can be deeper into the enamel leading to the periodontal area, and so on. It's also categorized into 6 classes depending upon the location of the caries opening. Or caries is again now in the classical score based upon different degrees. Like the caries scoring is a very complicated issue, rather a very complex issue. It's one of the major areas of the dentistry, and this scoring would decide like whether the tooth can be salvaged, or whether you need to remove the tooth, or whether you need to go for root canal treatment, and so on. Now the scoring is done by, there are two aspects of the scoring. Scoring is based for one, the visual scoring system for pits and fissures, the visible surface abnormalities, and the color of the tooth. One, if the color of the tooth is white, then there is a basic score of white, 1, and white brown, it's again 2, 3, 4, depending upon the color of the tooth, and depending upon the lesions, number of lesions and appearance, you will have again the score like F, E, and so on. The different names are given, and this another set of the scoring would be based upon the surface system for the smooth surface characters of the enamel. Depending upon surface character of the enamel, again you will have the scores like again FVP, DD, that's the same this pattern, and the combination of these two scores together would be the deciding factor, like whether you need to remove the tooth or whether you can salvage the tooth. Of course, I will not go into the detail of all that, but this kind of a system of grading the here is a practice, regular practice. Sushil has summarized these gradings into 5 categories without giving these detail. That's all. Sushil has said, Dantam Mulagata Natya Panja. There are 5 grades of these, and now you may have more grades. When you go into that scoring system, you may have more grades, or number could be varying, but that idea of planning the condition based upon the severity of the pathology is reflected when Sushil says there are 5 varieties of the nadis. That's about the Dantamula. The next is Dantagataha, the diseases related to the teeth acid. And when I say Danta according to Sushruta, it is the visible portions of the teeth which have to be considered. And they are Dandagataha, Dalanaha, Krimidantakaha, Dandaharshaha, Bhanjanakaha, Dandasharkara, Kapalika, Shavadantaha, and Hanumokshasteti. Now, many of these diseases which are considered by Sushruta as Dantagata in the present day situation may not be the diseases of the tooth, they may be either the gums or maybe something beyond the tooth, like Hanumoksha, which is a dislocation of the maxillomandibular joint. Now, some of them, of course, are the same. Dadyante bahudha dantaha yasmin tivra rudanmitaha dalanah sabijneyaha sada gati nimittajaha. Now, Sushruta has named the dalana as one of the conditions where the teeth become fragile. They tend to get cracked easily, and it can be painful. It also results in painful. A fragile or brittle teeth could occur due to multiple causes. One of the disease which makes the lesion teeth brittle is a tartar, where there would be deposition. Now, and the appearance of the teeth will be significantly affected. Beyond that, those teeth which otherwise look to be nearly normal, but they have more fragility, they could occur due to multiple causes, and the well-known causes are genetics. There are certain families or certain genera who have that tendency for having the brittle teeth. Eastern part of the country, northeast people, like people from Mizoram and so on, Nagaland area, that the brittle teeth issue is more common. And or maybe it also may be related to the geographics. Those areas where there will be fluorosis, increased content of the fluorine in the water, there too the brittle teeth is quite common. Either it's genetics, environmental factors, then it also related to the dietary habit. Those who eat sugary and acidic foods like your Sprite, Coca-Cola, etc., that beverages which contain sugar as well as sour substances. Brushing the tooth very forcefully, poor oral care, certain of the medical conditions, diseases where there could be abnormality of the calcium metabolism, hypothyroidism can also result in the same. Infective pathologies also can result in the brittle teeth. Certain medicines also, particularly tetracycline, in the tetracycline the teeth tend to become brittle. At the same time, it will be also discolored. So we will consider that as in the Shavadantaka. Then inflammatory pathologies of the gums also can result in the same, and bruxing, that it is grinding, also can result in the brittle teeth. Then Krishnashchidri Jalahasravi Sasamrambo Maharujaha Animitarujo Vata Vijnaya Krimirantakaha. Now Krimirantaka and Dantanadi which is considered as Dantamulagata Vyadhi by Sushuta, and Krimirantaka, from the current point of view, they are the same. Because caries. But when a caries presents at a very wide edge, that's class 3 type of the caries, where the teeth edge's enamel is completely destroyed, which presents with the Krishna Chidri, quite big black opening over the area, and the tooth becomes movable, and the canal structure is affected. Severe pain, Sasamrambaha Maharajaha, there could be pain and hypersensitivity. That's considered as a Krimidantaka by Sushruta. So, from the present day's point of view, it's an advanced stages of caries, higher class 3 or beyond caries, where the enamel is complete, or major portion of the enamel is destroyed. Anyway, that's about one of the condition. Then शीतम उष्णं च दशनं दशनः सहन्ते स्पर्शं च यस्य तं दन्तहर्षं तं व्याधिं विद्यात् समीरणात्. Now, this is a situation where the person would have a hypersensitivity to the heat and cold. Now, we have discussed about the issue of hypersensitivity to teeth earlier. Hypersensitivity to the teeth can be either due to the pressure or touch sensation or to the heat and cold. Now, as I told earlier, when there is a heat and cold sensitivity, that's suggestive of an exposure of the nerves to the surface. The nerves are exposed, or the enamel and the dentine has become eroded. Now, this is typically seen in case of the erosion of the tooth enamel. Now, erosion of the tooth enamel can present with the typical appearance where the tooth surface of the tooth will be yellowish color and thinned out, and at times you may be even able to see the root structures. It could be seen on the oral surface or the perioral surface, outer surface or the inner surface of the tooth, or on both the sides. It can be seen. And these incidents of the erosions are now becoming more common because of the food habits, particularly those junk foods like your pizza and so on, and those who have a habit of eating very hot substances, or the irritated drinks like your Sprite, Coca-Cola. These are the well-known causes of the erosion of the teeth enamel. Teeth enamel erosion also could be attributed to systemic disorders where the persons are taking lots of medicines, particularly glucocorticoids. Glucocorticoids taken for a long time can also result in erosion. Patients with the renal pathologies, they have a high chance of developing the erosion of the enamel. So these are the other conditions which could be a cause for that. But often it is presented as a hypersensitivity tooth. Hypersensitivity of the tooth is a very common presentation now because of the lifestyle as such, and now it's also the whole technique of dealing with that would be reduce the sensitivity of the nerve endings. So you will have all the different varieties of the toothpaste which make the nerves numb. Now, this is the usual thing, and it's one of the commercially advertised products. Like these are very frequently advertised commercial products, and many people use that the toothpaste which can make the nerve numb, which are also called as sensitive responding toothpaste. One of the problem with these would be when you use that sensitive toothpaste, it makes the nerves numb, and hence the person would be exposing the teeth to the injuries more frequently because there is no sensation. The person would consume heat and cold substances, anything, any other irritant substance like corrosive drinks also can be consumed continuously, and it hastens the damage. The damage to the teeth would be hastened. Instead, the other approach should be a crowning of the tooth. The teeth enamel now can be covered, and crowning is usually a better option. But people would always go for a shortcut, and that shortcut, which is quite popular, is the toothpaste which reduce the sensitivity of nerve. It's something like the local anesthetics, not really the same lignocaine, but derivatives of the same similar substances are used in that, so that the nerve endings will become less sensitive. So that's not the real correct approach. Then the next is Dantabhanga. Vakram bhavedyasmin Dantabhangashya tivrarako kapavatakృతో వ్యాధి sabhanjanaka సంహితः. Many of the injuries to the teeth, it could be any lesions of the teeth, can result in a simple localized palsy, particularly tooth root abscess, particularly very specifically tooth root abscess, or damage to the tooth, particularly upper jaw. Injury to the upper jaw can result in the damage to the hypoglossal nerve areas, branches of the hypoglossal nerve, and that could be a localized palsy. Unlike that of a typical facial palsy, you will not have the involvement of the muscles of the forehead. It's only the localized facial palsy can occur, and that is considered as a bhanjanaka by Sushruta. Bhanjanaka is a vakram bhavedyasmin, where the face becomes deviated, and it also dantabhangashya, damage to the teeth also would occur, and pain is considered, and we may categorize this as the localized palsy of the hypoglossal nerve produced due to the tooth lesions. Very often it occurs due to the tooth root abscess, or many times it also be a consequence of the treatment of the tooth. Many people who are where the molar teeth are removed, that could be resulting in the damage to the hypoglossal nerve, and that could be palsy. And in that condition, it may be a permanent feature also. Then the next is Danta Sharkara. Sharkareva Sthiribhuto Malo Danteshu Yasyavai. Sa Dantanam Gunahari Vijnaya Danta Sharkara. Danta Sharkara is where there would be deposition of crystalline substances which become hardened, and it's also called as Dantamala. And Sushruta has used the two words Dantamala and Dantasharkara. Dantamala is when the deposition is relatively softer and can be easily removed. Sharkara is when it becomes harder. Now we use the word plaques and calculi for the same. It's also a complication of tartar. The disease name is the tartar is other name. Now the only differences are that of course there will be deposition of a fragile substance over the teeth, and teeth enamel as well as enamel can get covered over the area, and which needs to be removed. Of course, by technically it's defined as a plaque is considered as colorless to pale yellow deposit, whereas tartar is defined as a yellow or brown colored deposit. Depending upon the color, we use the term plaques or the tartar or calculi. Calculi is when it is very hard and fragile. Of course, deplaking is the usual treatment. These depositions have to be curated out, removed out, so that the further damage to the enamel can be removed. And the commonest cause for the tartar is again the food habits. Those who have a this habit of consuming sour and sweet substance, sugary sweet substance like sherbets, and your aerated drinks, like same Coca-Cola, Sprite, and so on. They have a high risk of developing the tartar, and it also can be a later cause for the damage to the teeth. or those who eat very hot or very cold substances. Ice creams or very hot substances also have a tendency to develop the tartar, and the tartar, if it is not removed properly, it can result in a damage to the teeth later. Then Dalanti Dandavalkani, Yada Sharkaraya Saha, Nyaya Kapalika Seva Dashanana Minashini. The same tartar, when it becomes a cause for a destruction of the tooth, that's called as kapalika. So now, in the present day situation, we consider this as a tartar and the complication of the tartar as the damage to the teeth. Sushruta has considered this as Danta Shankara and Kapalika as the two stages. When the same Dantabalka, the enamel of the teeth are damaged with the Shankara, along with the Shankara, and the tooth is destroyed, Dalanti, then it's called as a Kapalika. So the name of Kapalika is about the destroyed teeth due to the tartar. Then Shavadantaka is when the teeth are discolored. Yo asum mishena pittena dagdaha dantasto sheshadaha shavtam niratam mapi gatahas shavadantaka stained teeth, where the teeth color is altered. Causes for the stained teeth are many. The most common cause is the drugs, particularly tetracycline. Well known is tetracycline, established. All the tetracycline derivatives, tetracycline as well as its derivatives, they are well known to produce this, and particularly in younger age. Lots of other drugs are well known. Metal and metallite substances also can result in the discoloration of the teeth, and the stained teeth is another. Of course, stained teeth also can occur due to the cosmetics used or toothpaste used, but more important is the systemic factors which can produce a stained teeth as such. And Sushruta has considered them as a Shavadantagha. Asat Mishrana Pittera, Dagdaha. There will be metabolic changes in the tooth, and the whole tooth will become discolored. Stained teeth would be a sign of assessing the causes, and most of the factors which result in the stained teeth also reduce the life of the tooth. So patients tend to have a early destruction of the tooth. Then last of the Dantagata Vyati according to Sushruta is the Hanumoksha, where there could be a dislocation of the maxillomandibular joint. Of course, dislocation of the maxillomandibular joint from the present day situation is not considered as a dental disease, but it's a orthopedic condition. But Sushruta had considered this as a dental disease because the activity like biting a hard substance can be a cause for the dislocation, or yawning also can be a cause for the dislocation. From the clinical point of view, it's one of the frequent condition. Hanumoksha is the frequent condition. Sushruta has used Latena Titihi Bhavestu Hanusandhi Visamhata, when the Hanusandhi is dislocated, dislodged due to multiple causes. It also has a feature of ardita. It may result in acute pain also, and the face will be kept open. Now, from the clinical point of view, one of the important is the dislocation of maxillomandibular joint is quite common. Very often it occurs after yawning, laughing, etc., and the patient keeps the mouth open. Now, if at all you come across such a patient, do not try to close the mouth by pushing the chin directly upwards. Instead, you have to put the finger in over the last molar, and the last molar has to be depressed downwards and towards the inwards. And this pressure is important. And then only the chin has to be lifted upwards, and then it has to be converted normal. If you do not follow that procedure, the styloid process, which is a delicate process, it can get damaged and a permanent damage can occur. So one of the important thing which you have to remember in case of the maxillomandibular dislocation is the procedure of reduction, and it's a easy procedure. Actually, it's easy if you know the technique, and it can be very gratifying. Patient who is not able to speak, who is not able to swallow, keeping the mouth open, will be in acute distress, and within 2 minutes you can make the patient feel normal. But you should know the correct techniques. So that's the all the important thing in case of the Hanumoksha. With this, the diseases of the teeth or danta are over. Now, the next is about Diffa and others, which we will continue in the next session. So, as the time is up. So, if there are any questions, we will try to answer the question today and then conclude today. In the next session, we will conclude with the the Nidanasthana, and then we'll enter into the Sharirasthana. Right, there are no questions, so we'll wind up now. Right, no questions.